the final component of our training, is where to actually place the handpiece by condition. Each slide is noted by a key that indicates either trigger points, which are red X's, dermatome points, which are the X's noted on the dermatome chart, a 0, which indicates lymphatic points, or a yellow X, which indicates where you're treating over a vagus nerve. Each of the slides is an area that could potentially generate pain for a client. So initially you ask the client to identify where their most painful condition is. You treat that, you treat it through the range of motion, and then finally you'll palpate any of the red X's to identify if there's painful areas where they don't even know that they exist. When you start to palpate a red X area, make sure you use firm pressure and consistent pressure, because you'll be post-testing as well. And you want to use the same amount of pressure when you finish as when you start, so they can notice the change in the pain. You'll treat until the pain is a 1 or less, and you'll treat typically 1 to 2.5 minutes per point if you're actively treating a trigger point. On the dermatome side, that treatment area is going to be 2.5 points in the minutes, and then you're finished completely, because you're just affecting the nerve that innervates the pathway of where the pain is. So for example, if you're treating jaw pain, you would treat over the cervical spine, because that innervates the jaw and the face. If you're treating a knee, you would treat over the low back ranges, because that innervates the knee itself, but you're only treating the spine for the dermatomes. Your settings for your treatment points are going to be based again on the depth of the target. Some locations are shallow, some locations are deep, so make sure you refer back to your depth of penetration based on 1 to 6 centimeters of treatment depth. These will vary based on the individual in front of you. For example, if you're treating neck pain, if you're treating a senior person that has very little muscle mass, or a child that's maybe 12 or under, your target's going to be relatively shallow compared to somebody that's average size, or potentially somebody that's overweight or heavily muscled. So your depth of treatment is based on the person in front of you. But the trigger point areas and the points that could generate pain are very consistent person to person. The following slides show every anatomical position that we typically treat with light therapy based on FDA clearances. Remember, the more thorough you are with the therapy, the better the outcomes will be, and the longer the pain relief will last for that client. So it's incredibly important that when they present, you treat local, through range of motion, and then palpate for additional points if the time remains. And then finally, lymphatic points, and then your dermatome points. Enjoy the process. You're going to realize how effective a tool a laser therapy device can be for relieving pain and inflammation in your clients' conditions. You are going to change their lives for the better. Be confident in what you do, because you already know more than they do, and you'll continue to learn and grow and become an artist with this technology. It's exceptional and it changes lives, so enjoy the process.